I'm Gail Miller from Aged Care Explained. Welcome to my Myth Buster series. Today we're busting aged care myth number 6. It's I'm too young to start downsizing. Maybe or maybe not. I don't know about you, but most people I know have got too many things, including us. So a couple of years ago, my husband and I, even though we're in our 60s, started downsizing, or I'd prefer to call it right-sizing. Most of us have got things that we don't use, things that we've accumulated, things that we're keeping because we might need it one day, but we've had it for 15 years. So it's time to think about moving some of those things on. Sometimes we can move them on to somebody who actually wants them and would use them. Sometimes we can move them on to an op shop. Sometimes they can be sold on Gumtree or eBay. There's all sorts of things you can do to reduce the amount of things that we actually have in our home. Everybody's got stuff. What actually happens though, when people get older, if there's an aged care crisis and somebody ends up in hospital and suddenly they're told that they can't go home, their families are faced with the problem of what to do with 50 years worth of mum and dad's stuff. And they're quite often at the same time looking for an aged care home or trying to sort out in-home care services, and they've got all this stuff to deal with. Please don't let that happen to you. There are actually professional organisers out there who do this as a business. They help people to declutter. If you don't want someone helping you to do it, quite often they'll have templates that actually spell out how to do the process. One professional organiser I know suggests that you just do one drawer every day. If you look at it like that, that's actually achievable, isn't it? When you think of a whole house full of clutter, it's so overwhelming that you just want to bury yourself, you don't even want to start. But if you think about one drawer each day, that's achievable. They say don't try and eat the whole elephant at once. You know, if you just start with one toe, you've got a chance. So that's something worth thinking about. If you really can't face doing it on your own, then I know of professional organisers who can actually help you to do it in a really caring fashion, not by bulldozing, all your stuff out of the way, but by actually talking through it with you and figuring out what the emotional attachment is for each thing that needs to be considered. So it's worth thinking about. Please don't leave all your clutter for somebody else to deal with at some later time. Stay tuned, and we're going to bust aged care myth number 7 very shortly.